इस वीडियो में हम डॉपलर अल्ट्रासाउंड के बारे में पढ़ेंगे। डॉपलर अल्ट्रासाउंड ये टॉपिक अपकमिंग एग्जाम के लिए बहुत इम्पोर्टेंट है। डॉपलर यूएसजी measures blood flow velocity. It is based on Doppler effect. Frequency shift occurs when sound reflects from moving RBCs. Moving towards probe increase frequency. Moving away decrease frequency. No motion, no Doppler shift. Doppler shift proportional to velocity. Angle of insolation affect accuracy. Ideal angle for Doppler is less than or equal to 60 degree. At 90 degree Doppler shift becomes 0. Types of Doppler. Continuous wave Doppler measures high velocity. Pulse wave Doppler measures specific depth. Color Doppler shows flow direction. Power Doppler shows flow intensity. Spectral Doppler gives waveform. Continuous wave Doppler has no depth resolution. Continuous wave Doppler has no depth resolution. Pulse wave Doppler suffers from aliasing. Color Doppler is angle dependent. Power Doppler is sensitive to low flow. Duplex mode is equal to B mode plus Doppler. Color Doppler basics. Red color means flow towards probe. Blue color means flow away from probe. इसका एक रूल है जिसका बोलता है BART. Blue away, red towards. Color scale can be inverted. Turbulence flow shows mosaic pattern. Color box size affect frame rate. Smaller box means higher frame rate. Color gain affect noise. Excess gain causes color bleeding. PRF or pulse repetition frequency controls color sensitivity. Spectral Doppler. Spectral Doppler displays velocity versus time graph. X-axis denotes time, Y-axis denotes velocity. Above baselines is equal to towards probe. Below baseline means away from the probe. Peak systolic velocity means PSV is key parameter and diastolic velocity is important. इसको EDV भी कहा जाता है. Spectral broadening indicates turbulence. Window fillings suggest disturbed flow. Baseline shift helps visualize waveform. Doppler indices. Resistive index RI is equal to PSV minus EDV by PSV. Pulsatility index PI is equal to PSV minus EDV by mean velocity. Resistive index reflect vascular resistance. High resistive index is equal to high residual resistance. Low resistive index means low resistance. Kidney normally has low RI. Tumors show variable RI. PI or pulsatile index reflect pulsatility of flow. Used in obstetrics. Doppler important in fetal monitoring. Aliasing artifact occurs in pulse wave Doppler due to pulse repetition frequency limitation. Appears as wraparound signal. High velocity causes aliasing, increases PRF to reduce. Low frequency reduces aliasing. Baseline shift helps correction. Use continuous wave doubler if severe, seen in stenosis. This is common in carotid doubler also. Now we discuss about doubler artifacts. Aliasing is most common artifact. Mirror image artifact may occurs also. Blooming artifact occurs due to high gain. Flash artifact from motions. Spectral broadening may be artifact. Noise affect Doppler signal. Angle error leads to wrong velocity. Wall filter removes low frequency signals. Motion causes false signals. Incorrect PRF effect quality. Now I discuss about some clinical applications of Doppler ultrasound. Used in vascular studies, detects stenosis, evaluates thrombosis. Used in carotid artery imaging. Used in deep vein thrombosis or DVT. Also used in portal vein study, evaluates renal artery. Used in transplant monitoring. Used in tumor vascularity. Used in obstetrics. अभी ऑब्स्टेटिक्स में डॉपलर का क्या रोल है? In case of obstetrics, Doppler accesses fetal well-being. Umbilical artery Dopplers is common. MCA Doppler detects fetal anemia. Absent diastolic flow is abnormal. Reverse flow indicates severe compromise. Used in IUGR evaluation. Placental insufficiency also detected. Ductus venosus Doppler used. High resistance indicates pathology. Regular monitoring required. अभी हम बात करेंगे वास्कुलर डॉपलर के बारे में. Normal artery shows triphasic waveform. Veins show phasic flow. Loss of phasicity suggests obstruction. Turbulence indicates stenosis. Increased PSV indicates narrowing. Post-stenotic turbulence seen. Collateral circulation may develop. Venous thrombosis shows absent flow. Some technical parameters to remember. PRF means pulse repetition frequency. High PRFs leads to high PRF detects high velocity, low PRF detects slow flow. Gain controls signal amplification. Wall filter removes motion noise. Sample volume defines region. Doppler angle correction important. Depth affect PRF. Frequency affect penetration. High frequency means better resolution. Power Doppler. Power Doppler shows amplitude of signal. It is more sensitive than color Doppler, not direction sensitive. Useful in low flow states. Also used in tumor vascularity. Less angle dependent, more prone to motion artifact. This is used in renal perfusion. Also useful in inflammation detection. No aliasing artifact. Limitation of this. Operator dependent angle dependency affect accuracy. Obesity reduces quality. Bowel gas interfaces. Limited penetration at high frequency. Motion effect result. Deep vessels difficult to assess. Calcification causes shadowing. Not ideal for all vessels. Requires experience. Now we discuss about some advanced concept of Doppler studies. Duplex Doppler combines imaging plus flow. Triplex Doppler combines B mode plus color Doppler plus spectral Doppler. Harmonic imaging improves quality. Contrast Doppler enhances flow detection. In case of contrast, we use microbubbles as USG contrast. Also used in interventional procedures, helps to guide biopsies. Used in arteriovenous fistula evaluation. Used in liver cirrhosis study. Portal hypertension assessed. Tumor angiogenesis studied. Now the safeties for Doppler studies. Doppler study is completely safe because it has no ionizing radiation. It uses high frequency USG ultrasound waves. It is safe for pregnant patient. Thermal index monitored. Mechanical index indicates cavitation risks. Avoid unnecessary exposure. Safe for repeated use. No known for major biological hazard. Widely used in pediatrics. Non-invasive and cost effective.